This podcast is kindly supported by our friends at Acre Pharmacy, one of the key aesthetic pharmacies leading the way in responsible supply. Right, so here with us virtually today, we have Anne from Jalupro. She is one of their directors and pharmacists. So Anne, could you introduce yourself and tell us a little bit about Jalupro, please?
Thank you very much, Meg. So happy to be with you girls, and I'm so sorry I'm virtual and not with you guys. It would have been so much more fun. So yeah, my name is Anne Gaille. I'm French, and I'm marketing director of Jalupro. And this product is amazing because for me, it was, with a long career in aesthetic, it was almost a kind of game changer. Like talking about amino acids can seem very simple, but at the same time, it makes the whole difference. And I was speaking with one of my colleagues a couple of weeks ago, and we were talking about the origin of amino acids. Basically, it's the whole foundation of life. It's why we build protein. We don't know if it's alien or if it's coming from a meteorite or something like that. So the whole amino acids really bring life to to human beings, basically, or to the whole planet. So working in aesthetic for 10 years, there was a lot of fillers, a lot of Botox, and then I had to dig into the collagen story, basically, and the connective tissue story, and realize that if you take collagen, for example, it's 70 to 80% of your skin. It's not only in your skin, it's in the deep structure of your face. Basically, it explains all your aging process, and not only from an aesthetic perspective, from your face, but in your whole body, basically. So I really, found something that could nourish my scientific backgrounds of working with the pharma. So it's not only talking about aesthetic, it's talking about health. Health of the skin, health of the body, and longevity. So it's not only cosmetic procedure, it's really long-term, talking about how you can really age gracefully. We talk that the Jalupro rejuvenation, basically, because it's not like, okay, I have a red carpet, have a party or something, I want to glow, so I do a lot of hydration, but it's really working on the long term, and working for the rest of your life, basically, with a product that can really, really bring you something much more than just a cosmetic procedure, basically.
I think all three of us were blown away when we travelled to Istanbul recently with Jalupro, and I think I can speak for all of us that we all came back like buzzing and totally inspired to almost play around with Jalupro and see how it can almost be integrated properly within our practices, because I think the main thing that we're hearing is a lot of people know the name, but they don't quite understand the science. And I think that's half the battle, isn't it? We've got them, they understand, they've heard the name, they're making that connection, but they still have this lack of understanding of really the role that it plays. I know when you and I spoke at the Jalupro conference in London, I remember one of the delegates asked a question and said, I have a patient who has this. How do I explain to them they have to replace it with Jalupro? And you eloquently replied, you don't need to. And it's getting that message across, isn't it? And so you've obviously created lots of amazing learning materials that all three of us have looked at and have seen delivered now globally, which is incredible. What would you say is the main message that you're trying to get people to take whenever they listen to or join into one of the webinars or attend one of your trainings? What do you want them to walk away understanding about the whole range?
Mm-hmm. So for me, Jalupro is not an additional product you get into the clinic. It's really to help you to make a better job with your current practice, basically. The whole thing comes from the fact that a lot of the time people thinking that we create things in the body by magic. So for instance, you would stimulate your fibroblasts and then magically it will create collagen or whatever you want it to create. But it's not that simple. And it really, that's why I say it's very simple into the explanation, but it's not that easy, because a lot of of practitioners, they've learned that very early into their studies or their education, and we forget about the basics, basically, how physiology is working. So it's coming back to the deep physiology, and then basically the fibroblast is just a factory. So if you don't bring the raw material to the factory, you don't produce anything. And what we realize when it comes to amino acids, so amino acids, they are the building blocks of the collagen, which is a protein. And then the fibroblast needs the amino acids to create the molecule of collagen. What we realize is because of the modern lifestyle, because of we don't eat enough protein, or with aging, we don't digest enough the protein, or sometimes people are vegetarian or vegan, which is fine, but then there's a chronic deficit in amino acids overall for our body, basically. So if you can stimulate a lot of things, but if the body doesn't have the resources to create the collagen itself, it's a bit hopeless. And then you will create a little bit, but you will not create very much. And when you think about how stress is impacting your destruction of collagen, how it's going to be Christmas, we're going to eat a lot of chocolates and we're going to party and everything. Sugar is destroying our collagen. Lack of sleep is really destroying our collagen. So if you put all this lifestyle burden on our body, it's very unlikely that you will have enough resources at skin level to create and to maintain good collagen. So that's why bringing the amino acids is really a game changer in terms of results and outcome for the patient, because for the moment you are stimulating, and then if you add these very simple ingredients to the equation, you will see the results really developed and optimized, and your patient will be, thrilled and very, very happy about the results.
So you talked a little bit about using multiple modalities. It's not just one or the other. It's kind of a combination of everything. And taking it back to being in Istanbul, we definitely saw some really passionate speakers and about the projects that they've kind of undertaken and studies that they've done, one of which was the orbital region and also the perioral region, which I found really interesting, and kind of utilizing the product before you then go on to use dermal fillers, or maybe not needing to use dermal fillers. So my question would be, because you've launched recently Young Eye, just kind of what makes it a different product, and kind of, going from there and educating us, really, please.
Thank you very much for the question. It's the approach we have is that we are not, for Young Eye, for example, we are not treating under eye. I hear a lot that under eye treatment. Why do you want to treat only your under eye? I understand about the dark circle and everything, but your skin is everywhere. Your aging process is around your periorbital area. So we never treat only a tiny piece of the face. We always treated, what is the need from a physiological perspective, the skin. So then you need to treat the whole face, basically. And then you need to treat deep structure as well. So it's the same for Young Eye. We're not treating under the eyes, we are treating the periorbital area. And in this approach, we really like to combine this Young Eye treatment with Superhydro, which is treating the ligaments. Because if you want a nice, useful look, basically, or upper face, you need to make sure that you have enough structuring and enough lifting effect. So you need to work deep as well. So the difference is, and after the technology is always the same, you bring the amino acids to feed the fibroblast and it will restore the whole skin, basically. And when your skin is more dense because you have more collagen, then you don't have these kind of symptoms of the periorbital area, which are the dark circle. The dark circle, are because your skin is very thin in the area, so you see the muscle in transparency. You're losing your fat pads. This is the first fat pad you're losing with aging, basically. So if you don't have any connective tissue here, you will have very, very thin skin, and you will see, your vessels, your muscle. It gives this pigmentation. And and then you will tighten the skin as well, increasing your collagen. So you will decrease this depression, this hollowness, and all the symptoms that usually you have in this orbital area. And I would say on top of that, you really need, when it comes to the eye area, and one of the main concerns is dark circle, check the vitamin D level of your patients, because now it's winter. We all know that in the Western world, we don't have enough vitamin D. So it's an aggravating factor for dark circles. So if you have young patients with dark circle, of course they're partying, of course they're stressed, of course, they have all those, lifestyle things that will make the dark circle, but check their vitamin D level, because it's going to be worse with that. So vitamin D plus restoring the skin, it will really help to treat all the symptoms. And don't do under the eye only. It doesn't make sense to me. Your patient is not just under eye, it's you need to go to the full, holistic approach. This is the best results and the best service you can give to your patient, basically.
So Anne, one question I think we'll get asked is, what is the treatment protocol and how often will the patient have to have it done to maintain those results?
So all our protocols, basically, for collagen, you need to understand that working only one shot, that doesn't really do the trick. You really need to feed your fibroblasts regularly. So we always talk about starting with a kind of booster protocol, and the booster protocol is a course. So you need, we say 3 to 4. And I think here as well, there's a kind of a misunderstanding. I think a lot of practitioners, they're a bit afraid about their patients, say, okay, I will start with 2. If you're happy, that's enough. If you have already good result with 2, imagine the result you can have with 4, because there's a cumulative effect. So I always push for go to 4 injection in the beginning, because you will really make a strong result from the beginning. And after you do a maintenance protocol, meaning that every 3 months, you feed again your fibroblasts. So you do 1 injection every 3 months. Once you did the course, you can wait for 4 months. And I remember one of our KOL, Dr. Mantieva, was telling, basically when your patient is coming back, you can, if you're afraid to sell the maintenance and the too many protocols, you can ask them, do you want to go back to baseline, basically? If you wait too much, you will go back to your old self. Is this something you want? I bet 100% of patients will say, no, I'm so happy with the result. I want to keep the result. So why do you want to wait for the product not to work again, basically, or the effect to disappear? You need proactively to re-inject to make sure that you have much better, you maintain the result, basically. You don't want your patient to go back to their old self. You want your patient to keep their best, basically. So that's why it's very different concept than botulinum toxin or filler, where you really wait for the wearing off of the product. You really need to maintain the results and to be proactive in this maintenance, basically.
And you've just triggered something when you mentioned botulinum toxin, because I know when I attended your event in London, one of the things that you were sharing is how you can combine classic with botulinum toxin. Have you, for those who aren't watching, what's the logic in doing that?
Botulinum toxin is not, and before working with Jalupro, I was working 10 years for D-Sport, so I really like botulinum toxin. It's a kind of it has been my baby for many years. So botulinum toxin in intradermal technique. So it's not injection in the muscle; it's intradermal. It's totally off-label. Regulatory disclaimer. So it has effect on the skin itself. So there's some study showing that it contracts the fibroblast. It acts on the oiliness as well. So people with oily skin, there's a lot of data and publication about that. And the thing is that in your face, your muscles are not surrounded by fascia. So there's no separation between the muscles and the other layers in your face. So the toxin will diffuse very gently to the superficial layer of your muscle, and it gives a very small relaxation. And in some areas of the face, it's what you want. Especially there was some study in the frontalis muscle where you have this problem of brow ptosis, for example. And doing intradermal technique on the frontalis prevent this ptosis of the brows. Instead of injecting deep in the frontalis, you do almost intradermal, very superficial injection. So then it allows not only to act, the intradermal toxin acts on the quality of the skin and just relax slightly the muscles. And when you combine with Jalupro, basically you get the best of both worlds. So you work on the quality of the skin with Jalupro, you work on the quality of the skin with botulinum toxin, and then you have a gentle relaxation. And coming back to the periorbital area, it's a very good technique because you will keep the movements in your eye area, in your crow's feet, basically, but you will protect your skin against the wrinkles. And I really like this protocol there because, I don't know if you know, but you don't smile with your mouth, you're smiling with your eyes. And a lot of people, they inject so much in the crow's feet because they're afraid of the wrinkles that they look fake. They are not able to smile anymore. So it's a very good protocol to be able to express fully yourself in terms of smiling, positive emotions, and then at the same time protect your skin against the movements and not create wrinkles in this area. So it's a great protocol. It can be used. We have, Dr. Shinamba, it's another one of our KOL. She did a recent poster in EADV about Yalutoxin. It's good as well for rosacea. It's good for oily skin. So there's a lot of benefits as well of this protocol. It's good for the neck, the décolleté as well. Intradermal toxin was used in those areas a long time ago as well. But I really like it in the eye area, especially for people who want to be natural. All our Jalupro philosophy is really, you cannot go wrong. You cannot change your face. It's very natural because you work with your, I would say, inner beauty somehow, because you work with the cells instead of just stuffing the face with something or replacing something that has been lost. Really working with the intelligence of the body. So it's a great protocol.
Can I just throw another question in there, Anne? Sorry to jump on. So when we treat the periorbital region is always going to be really complex to treat. We know that because we're dealing with lots of anatomical issues. One of them, which anyone who deals with aesthetics, especially if the patients are 30 years above, is lymphatics. And I know that obviously we can compromise the lymphatics even with botulinum toxin. We forget the fundamental use of the orbicularis oculi muscle in that drainage function. So I think one of the things that I like the most about this is because when I'm teaching, we don't see enough practitioners really digging deep into that lymphatics and that malaripad and understanding the impact that it can have with any HA-based products. But am I right in saying that the amino acid, the background of the amino acid has a draining capacity on the lymphatics as well?
So it's not necessarily the amino acids. It's we have one peptide into the formulation of Anne Gaille that has a draining effect. So it will really help to decrease this effect. And on top of that, I always say that you need to check your patient beforehand. It's part of your success. It's really take the time to assess your patient properly. Some of them, they are not moving at all. We have a very sedentary life. We are spending hours in front of our computer. We're not moving enough. So the lymphatic system is not stimulated by anything else than muscles and movement, basically. So if you don't move, you don't stimulate your lymphatic system. It's stimulated by your breathing. And we know, I'm very into personal development, holistic and longevity things. We don't breathe properly. We don't breathe deep enough. And then we don't mobilize our diaphragm enough. So then diaphragm and vagus nerve is a stimulator of the lymphatic system as well. And then, as you mentioned, botulinum toxin, puffy eyes is a side effect of botulinum toxin because your lymphatic system is not managed, stimulated by the muscle. Filler as well, because it compresses those lymphatic vessels as well. And so if you draw the picture of the patient, you can prevent, or at least you can educate them and bring a little bit more health advices and services. Like, you need to do this before. There's thousands of videos on Instagram about lymphatic drainage of the face, how to depuff your face. It's very easy to find today. So go there or advise, pick the one you like and advise that to your patient. It can be manually, it can be with a gua sha, it can be with whatever device you want, but you really need, it's, I mean, for me, massaging the face properly it should be for every patient. Every time they do a procedure, I know with toxin and filler, you should not massage too much your face, but with Jalupro, you can do whatever you want. You can, it's even better if you massage your face properly. And then, so the amino acids will work on the wall of the vessels. So not only the microcirculation, but the lymphatic vessels as well. This is connective tissue. This is extracellular matrix as well. So the amino acids will work on that. And the peptides will work as well on the, direct draining effect of the face as well. So so that's why. And I really like Elena because she has a tremendous experience and she's full of advices. Just any explanation you give before, it's education for your patient. Any explanation you give after, it's excuses. So don't avoid discussion before the treatment, because then your patient will not call you in panic like, oh, it's so swollen, what did you do to me, what in rubbish did you inject? It's most of the time it's not a problem of injection, or it's not a problem of the product. It's because the patient is the patient. We're all different, and our lifestyle will influence our results as well. So that's why understanding and assessing the patient properly, it's 50% of your success in terms of clinical outcomes.
So with Jalupro, Anne, what kind of side effects can you expect to see using the new Young Eye product afterwards?
So I would say there's some side effects that are not because of the product. It's an injection. So when you see the number of vessels around the eye area, you can have bruises. This is for all aesthetic procedure, you can have bruises. You can have a little bit of swelling, because even with all the precaution we take, the product contains HA. So the property of the HA is to attract water. So of course, when you inject HA in an area, basically you will attract water there. So according to your baseline or lymphatic system, basically you will have more or less swelling. It's something we want. This is hydration, basically. Other than that, amino acids are very, very safe product. And what we chose with Jalupro is to give less product, but really targeted and just what is needed, because we don't want to clutter the skin with anything. So I'm touching wood, it's a new product, of course. We don't have, but so far so good. No side effects, except some patients get a little bit of swelling. What I didn't mention is the malar bag, and it's something you mentioned, Kate. We have this malar fat bag here that is very, very prone to swelling. And I've realized that some people, they're very scared to inject very close to the eye area, especially between the lashes, very close to the eye. So they inject very low, and they inject into these fat pads. And this fat pad is a sponge. So really suck the water. And so any HA you will inject there, basically, you will have this edema here. And a lot of people with age, especially, I think it's because of the, destructuration of the connective tissue in the malar bag. Adipose tissue is a connective tissue. So they have this constant edema here, this type of festoon. You can really see in many patients. So you really need to be careful, because this part really loves to attract water. Other than that, no allergy. We haven't seen any. And, Jalupro, it's 20th anniversary next year. It's been on the market since 2004. And then it's super safe product. We don't see allergy. We don't see major side effects. We're very lucky about that. Sometimes you have some reactions from patients. What I've seen sometimes as well, I really learn from all, the feedback I have from the world, is that with gravity, sometimes the product can migrate. Especially the HA. So then I've seen for me, it was not really a side effect. It was a little bit swelling into the malar bag, but it was 3 days after the injection. And then I thought, and I discussed with one of our KOL and our medical advisor. I said, but wait a minute, this is gravity. The HA is falling down, and then the edema is going down with gravity. So if you have a little bit of water retention here because of injection, it will start to fall down, and then if it falls into the malar bag, of course, you will have this swelling. So other than that, I would say no very safe product. No major side effects except a little bit of swelling in some patients. Some love it because they feel that when they are swollen, basically, it's like no wrinkle, it's volume, etc. So don't be afraid about it. And in terms of management, you need to play with time. Basically, you need to massage. Don't try to dissolve those products. The HA inside is very low molecular weight. It will disappear in a few days. It's not like a filler. You don't want to dissolve. With hyaluronidase, you will create much more inflammation. It's not like a candy, hyaluronidase. You will destroy and you will make much worse situation than it is. So just be patient, massage. You can use a little bit of radiofrequency if you want to stimulate or microcurrents. But other than that, we are super lucky, and you can talk to a lot of practitioners that use Jalupro. It's super safe product.
I know we're running out of time shortly, so I don't want to miss out on covering some of the key products. But so we've got in the range now. We've got Classic, which I believe is 100 milligrams of amino acids, isn't it? Yeah. And then we've got the HMW, which is slightly less amino acids, but more of the HA. Is that right? And then we've got the Super Hydro, which is, I know we shouldn't have favourites, but I kind of do. I love the Super Hydro. I think the reason I like it so much is because I feel like it's addressing something that we've not had before. I think that's why it gets me excited. So we've got the Super Hydro, which is kind of different to everything else because it's all about deep revitalisation rather than the superficial. And then we've obviously got the Young Guy that's come on, but we've also got you've got the cream that you've got as well, and then the amino acid drink. So there's quite a lot of products to really support your patients, like you say, holistically and for the long run. I think one thing that the girls and I have said that we're excited to do next year is to look at integrating the Super Hydro and even Classic with other treatments, other modalities within the clinic. Megan's got a Dermaforce, myself and Grace, we've got a Neogen. So how we can look at integrating that amino acid technology, science rather, with the technology that we've got in the clinic, and to see where we can have a play with that. I think it'd be really exciting.
Just so many different modalities available to us, I think, would go synergistically.
And Jalupro has really taken off this last year. We've seen a huge, lots of practitioners didn't actually know much about Jalupro, and now everyone's talking about it. So what is Jalupro's plans for the next 12 months, just to finish on that, Anne?
So to reinforce the education that we are doing, it's really something that we really like to do, and we think it's what makes the difference. We really need to expand the number of indications. As you said, there's so many indications, there's so many things you can do with your patient, integrating with your existing practice, doing combination with biostimulator like PLLA or other products, or using it as a primer for any new patient. Lips is a fantastic indication. So we will talk more about that, like new indication, new protocols. And then we are preparing some new products as well. So, it's all really DNA. Our DNA is really amino acids and collagen. So we don't want to go to, scattered around with new products, but really something that goes into the rejuvenation process. So we will launch like rejuvenation peeling, because it goes with that. Like basically the stimulation part of the fibroblast together with the amino acids. This is really what we like. So we are not yet ready on the timing, so I cannot tell you. We are still under discussion, but the next product will be a peeling and some more protocol, because our products, as you said, Grace, it's the brand start to be known, and so we really need to give all the tools necessary to practitioners to use it from an optimal way. There's so many protocols, so many indications. And to have 4 products can be a bit daunting sometimes for people. Like so many, I already have a lot of products, so which one I use? Unfortunately, it's not which one I use. You need to use them all, basically, according to what you really want to achieve with your patients. We talked about Jalutoxin, so it's going to be Classic. We talked about Young Guy. Super Hydro, as you said, Kate, it's a game changer because it's really inside the ligaments. So it's really about lifting, structuring. HMW, fantastic for lips. And now we have the trend of we don't want those big lips anymore. We want more natural lips. So it's a great treatment for that. So you can talk about hair as well. For men, it's a great product because one of the barrier for men is feminization. So with this product, you just refresh them, and it's fantastic a tool that you have to bring more patients in the clinic as well, and to have them very, very happy and coming back. And a lot of the time they will call you. You don't have to call them back to the next appointment. They will call you and they will run to the clinic to get their new injection. So this is really positive.
Do you know what? I've got to just draw on something you just said, because I was talking about this yesterday in a training session. And I feel ashamed to say that it's something that I've never even thought about before, but we treat lips. Lips is pretty much the first thing that we're taught to treat. And yet, and don't look at me in absolute disgrace here, but yet I've never really analysed the skin or to that level of, and yet I think it was Elena presented a case study, I can't remember if it was in London or Istanbul, where she had a patient that was having repeated nodules forming or basically displacement of the filler within the epidermis. And actually that concept of sometimes for some patients, we've got to prepare the skin, even in the lips, before we fill it. I mean, I felt stupid. I thought, after all these years, why have I never even considered that? And it seems so obvious. But again, we overlook that, don't we? And
great tool between if you are dissolving HA fillers and then you want to refill, we know the skin quality is never as great. You can prepare before refilling with the Jalupro. So
that was one of the studies I found the most interesting personally, because I do fill so many lips, and
how did
I was why have I not thought? I had the same moment.
Thinking, why have I not thought about this before? But do you know what, Anne, like you say, you're looking forward to the 20th celebration next year. We hope we're invited, just getting that in there. But what fun to have now, just really raising awareness of how we can really launch all these products and use it to maximize, like you say, a global approach in all our practices and
get excited about
absolutely. And hopefully we can work together to kind of spread that message, to spread that, because I think it has a real place in the market, and we need to make sure people understand
our toolboxes.
The toolbox,
the
Jalupro toolbox, absolutely.
Yeah. Well, thank you for joining us, Anne.
Thank you, Anne.
Thank you.
Oh, you're very welcome. It's a pleasure. It's always a pleasure to see you girls.
Thank you.
And we'll see you soon. Thanks again.
Thank you.
Thanks,
Bye-bye.
Anne. Bye.